welcome back to our Healthy Living Show. We are going to pick up where we left off last time with our discussion about diabetes. Today we are going to cover how one can take control of their own diabetes and how everyone can reduce their risk. I am joined today with two of our diabetes educators from the Purchase District Health Department, Julie Muscarella and Deanna Leonard. They are both educators for our diabetes program, and I just want to welcome and thank you for coming. This is really, we are doing this show very timely because November is the National Diabetes Month, and so we really want to get the word out about what diabetes is and how you can keep it in control. What is the, you want to tell me a little bit more about what are the resources available for diabetes?
One of the things that we have at the Purchase District Health Department are learning sessions that we offer 2 times a year. And at the learning sessions, there are many things that we discuss, but one of the first things we talk about, Kaylene, is actually what is diabetes? What is diabetes? What is type 2 diabetes? What is type 1 diabetes? Because there are several different types of diabetes.
Sure.
The major ones being type 1, type 2, and gestational diabetes, which is a diabetes that develops during pregnancy. Mm-hmm. So about diabetes, diabetes involves the body's pancreas as well as the body's cells. In type 1 diabetes, the pancreas actually loses its ability to secrete insulin because for some unknown reason, the body ends up attacking the beta cells in the pancreas that actually make the insulin. And so that's type 1 diabetes. In type 2 diabetes, it's a little bit different. And first, you have to have a genetic predisposition, so it has to run in your family somewhere. Mm-hmm. The next thing that happens is environmental factors happen. We get older, number one, older people tend to get type 2 diabetes. We get less active. People who are physically less active tend to develop type 2 diabetes. And also we get heavier. Heavier people tend to get type 2 diabetes. Mm-hmm. And just to kind of give a real general explanation about type 2 diabetes, when we get overweight, our pants don't fit. When we get overweight, our belts don't fit. And when we get overweight, our insulin doesn't fit the cells, because our cells actually get overweight and they get misshapen. So the goal is to control type 2 diabetes. Part of it is to reduce our cell size by lowering our weight just a little bit, and it really helps control that type 2 diabetes. Mm-hmm. And gestational diabetes, which occurs basically due to increasing hormones during pregnancy, is another type of diabetes that does have to be controlled very tightly. Mm-hmm. So,
well, that would be very helpful, because usually when people are told in the clinic, you know, you have diabetes, the anxiety and the worry and really not knowing what it is. I mean, you have to know what it is before you can really keep it in control. So a class like that would be, you know, awesome. What are some of the other things in your classes that they would be able to expect?
Yeah, so one of the first things we go over, besides actually explaining what is type 1 and what is type 2 diabetes, is we talk about the importance of monitoring your blood sugar. And we try to make sure they know the importance of writing down their numbers. And one of the things that we always say is that it's just a number. It's just a number, and when we have blood sugar issues, we're writing down that number to show our healthcare provider. That way, the person with diabetes and their healthcare provider will be more able to help them control their diabetes. Mm-hmm. Again, it's like you're putting on a detective hat. You're just writing down the number on the machine, and you're trying to figure out with your physician how you can best control your diabetes.
Sure, yeah.
So monitoring, that's with the blood sugar monitor, is very important. So that's one of the next things that we talk about. Okay. And of course we talk about healthy eating, and we talk about problem solving, like exactly what is you know, why is my blood sugar high? Why is my blood sugar low? Things like that. And also we talk about risk factors and how we can control the things that many of us know firsthand could be the result of uncontrolled diabetes.
What are some of the risks if you don't keep your diabetes in control? What could happen to our body?
Well, if we let our blood sugars stay out of control, which, you know, American Diabetes Association has set some blood glucose targets they share every year. For fasting blood sugars, for people with diabetes, they like to see them keep them between 70 and 130 milligrams per deciliter.
Isn't that a little high? I mean, normally you think, 100 is the number where they, say you're pre-diabetic.
Right, and for people without diabetes, their blood sugar should never go over 100 when they've not had any food or eaten. But in general, with people with diabetes, we expect that their sugars are going to be a little higher because their body is struggling and having trouble with it. But they're working along with their healthcare professional. They can find out where the right target is for them. That's why it's it's 70 to 130, so not everybody needs to be at 130, not everybody needs to be at 70.
Yeah.
And that can be determined, with their health and how they're doing in their treatment that their healthcare professional is prescribing for them. Also, too, we talk about what their blood sugar should be after they eat their largest meal of the day, and we encourage them to check their blood sugar. In fact, that's where diabetes begins many years before, is that our body starts having trouble processing the sugar from the foods we eat. And so our after meal blood sugars get higher and higher and higher until eventually our pancreas just can't keep up with that insulin production anymore.
Sure.
And so by the time you see our fasting blood sugars being too high and being able to be diagnosed with diabetes, that's kind of a late response from what our body's been going through this whole time. So the ranges are a little higher whenever you are diagnosed with diabetes, but the lower that you can keep your blood sugar and keep it in a safe range, the better you are at preventing complications later in life that can go, such as your eyes and problems with your kidneys, problems with the nerves in your body that affect various functions that go on in your body. And so control of those blood sugars and learning what affects their body, what foods make their blood sugar go up the highest, what activity and what exercise they can do that it makes it stay down. I had someone share with me the other day that they were surprised. They went for a walk, and when they came back in, their blood sugar was 90, and they were like, should it be that low? They were afraid. So we like to answer those questions. We love for people to come to our classes and have those questions and know how to handle those situations whenever they are at home and on their own.
Yeah. So it's not only a class that you will learn, but more of a support group too. I mean, you come with your anxiety or come with the questions of concerns, and they would be able to, get some sort of relief to, okay, now I get it. I think I, understand my body a little more, I'm sure.
Yeah, and I think it's very comforting to them to hear other people share those same concerns, and they realize they're not alone.
Sure.
There are other people out there with their same struggles. Now, we always tell people their diabetes is individual, and what works for one may not work for another, but in general, they all struggle with the same concerns, the same emotions, and that they just feel like that they're not alone anymore, that there is some support out there. And I think they really enjoy hearing from others, and they learn, and we learn as well from others, and hearing, because they're living it.
Right. Yeah.
And we appreciate that.
Now, you mentioned, foods that, raise the blood sugar. I think it's, you think, oh, candy bar, obviously that's going to raise your blood sugar. But are there other foods that are surprisingly really shoot the blood sugar up higher than you would anticipate?
About that, your question about what foods actually cause the blood sugar to go up, it's individual. It's different for different people. For some people, bread might be that factor that increase their blood sugar. Of course, milk sometimes can be a food that causes the blood sugar to go up. But of course, your sugar in the form of, you know, soda pop and granulated sugar, that really makes your blood sugar go up, and very quickly. So what Deanna was talking about regarding checking your blood sugar after your meal, that's taking the blood sugar an hour and a half to 2 hours after that first bite.
Okay.
So for people with type 2 diabetes and type 1 also, but your blood sugar is going to go up after you eat, but you just want to make sure that within an hour and a half to 2 hours that it's down into a safe range, and definitely before the next meal, because at the next meal you're going to have another sugar or blood sugar excursion. So one thing that we say is all foods fit, but what's frequently forgotten is in a well-balanced diet in which diabetes is well controlled. So that's a very good point, Kaylene, that you bring up about some foods may cause the blood sugar to go up. And the only way you're going to know that is by taking that blood sugar an hour and a half to 2 hours after that meal, after that first bite, actually. And I like the way Deanna was talking about walking, and which brings up another risk factor for diabetes, and for everybody actually, but especially for people who have any type of issue with blood sugar, and that is our feet. Because the feet is what, our feet are what hit the pavement.
Absolutely.
And our feet are what really bear the burden of our weight every day. And so part of what we talk about at length is the importance of good foot care. We talk about the importance of checking our feet every day. And what we're checking for is redness, any type of blister, any type of opening, cracks, anything like that, any opening that bacteria or germ might get into.
Sure.
And also we talk very, we love to have our patients say that they'll take off their socks when they go see their doctor, so that their doctor can look at them as well.
Sure.
And one thing that Deanna talks about is if you have any shoes in your closet that don't fit, get rid of them, because if they're in your closet, you will wear them. And we talk about what a shoe feels like that doesn't fit. It hurts your feet. It makes redness on your feet, and how that can cause blisters.
Right.
So, you know, our feet are the furthest we have from our heart, which is our pumping organ, right? So that's why we really like for our patients to have a good look at our feet, because changes in the feet can occur overnight. So we need to make sure that anything on our foot, anywhere on our body actually, a wound or any type of opening is healing properly and not getting worse.
Yeah, yeah.
And
This is not the time to wear those cute shoes that don't fit well, okay? But you can find cute shoes that fit, but you know, you have to draw the line. You know, it's more important to have healthy feet than to look good.
And we stress the importance that, you know, even something as simple as an ingrown toenail can turn into a very serious problem for those with diabetes, because the nerves have been affected, the blood flow to the foot has been affected. There's not that healing, that good healing there anymore. And we know statistically that over 80% of our amputations done on people with diabetes could have been prevented with good foot care. So education is the key on keeping them looking at their feet, letting their healthcare providers look at their feet, and doing that good foot care, not going barefoot. That would put them at risk for stepping on something, and then their physicians can keep watch on their circulation, their feeling in their feet, and make sure that they're protecting those feet, especially if they've lost some sensation or feeling.
Yeah.
They would know if they've stepped on something
sometimes does occur. And you know, how can they, you know, help with this?
Well, if they have decreased feeling or sensation in their feet, they know it because the doctor has done a test with a monofilament test, and it's just a thicker fishing wire implement. And they have a lot of other fancier tools, probably have some better terms than what I'm using or no, but they do a comprehensive foot exam on there where they can check the foot circulation very well. They check the motion. They check to make sure, especially on the points on our foot where we get most of our impact when we're walking, in that just right behind the toes, in the metatarsal area on our heel. Those are areas that have strong impact points. So they're going to make sure and just touch them with that little monofilament and make sure that you can feel this, you can feel this. And if they do have decreased sense feeling, then they need to know that they've got to do extra protection for their feet, shake their shoes out, make sure there's no pebbles that have gotten in their shoes, because even that small pebble can work a hole into a foot.
Sure.
That they don't have any little toys in there even. That they are careful with not putting their feet in hot water. They can't feel the temperature anymore if they have no feeling sensation, so being careful with the water temperature, and just making sure to always wear good supportive shoes, not going barefoot inside or outside of the house. And just those simple steps can help prevent any foot problems that they may have and prevent a future surgery on that. So,
Now you mentioned eyesight. What happens to the eyes with diabetes? What is the concern?
Well, with eyes, our eyes have very tiny blood vessels, as you can imagine. So, and with our blood sugar being affecting the whole body, whenever our sugar is too high in our blood, it goes everywhere in the body. So it affects our eyes as well. It affects those blood vessels, makes them weaker, and then they tend to want to bleed. And when we have that bleeding in our eye, that can affect not just right away our vision, but it affects the health of our eye and the tissue that's in there. And our eye and our body are great mechanisms. They try to repair themselves, but the new vessels that form are not like the originals. And so it can cause even more bleeding, lead to diabetic retinopathy, which is when the eyes are affected by diabetes, and can affect even up to the point of our retina when its scar tissue forms. The great news is, though, is that if they get their annual dilated eye exam, then, and that's where they're going to put some medicine in their eye and dilate their pupils where they can look in there real good, look at the health of those blood vessels. If they see any trouble starting or any problems with those blood vessels, they can treat that right away. They have laser treatment that can help with that and stop that bleeding, stop that weakened vessel, and hopefully protect that vision. Because if that bleeding occurs too close to the optic nerve and too close to certain points in our eye, that's where we have our vision loss.
Right.
And diabetes, uncontrolled diabetes, is the #1 cause of blindness in America. So doing that simple annual dilated eye exam
again, the
can
prevention,
help prevent it.
You know. Now I know, Julie, you talked about you know, the foods, and we've talked a little bit about exercise, but what should a person really look at when they're kind of planning out the week for a menu plan? You know, what should they be looking for in a meal, or, you know, preparing ahead?
So one thing, Kaylene, it's, you know, sometimes you can look at seasonal foods, like what foods are in season. And sometimes you can plan your meals around things such as that. And definitely, if you're looking for a budget-wise type of suggestions, that would be my first suggestion. Also, you can look at the ads, the grocery ads, and see what your family likes and, you know, what works for you. But when you're looking at your meals, you're looking at things that work for you. And how you know that is by taking that blood sugar and seeing, and are you satisfied? Are the foods that you're eating helping you stay on your meal plan and keep your blood sugar in a safe range? So basically, you want to have meals throughout the day, just like a car. You can't get to Lexington and back without filling up a tank of gas. Those meals need to come throughout the day,
Yeah.
and in particular carbohydrates, because our body prefers that as a fuel, right? And so you want to have those carbohydrates throughout the day. And not many people do not know this, but our brain needs a minimum of 130 grams of carbohydrate per day. That's a minimum amount, okay? And so men and women, of course, need different amounts based on their goals and their doctor's goals with them. Basically, you know, do they want to gain weight? Do they want to lose weight? Do they want to maintain their weight? And so that is more like an individual food plan. The general rule of thumb is for women, 45 to 60 grams of carbohydrate per meal, plus a 15 to 30 gram carbohydrate snack, if needed, maybe 2 to 3 a day. So this is a general rule of thumb for women. For men, since they're a little bit taller, a little bit more muscular, it's anywhere from 60 to 75 grams of carbohydrate, again, per meal, not per day, with a 15 to 30 gram carbohydrate snack. And at our classes, we talk a lot about what a serving size looks like and actually help people plan menus. And we actually give them a cheat sheet with different suggested meals that they could have that have the 30 grams, the 45 grams, as well as 60 grams and even 75 grams of carbohydrate. And the other thing that they look at are things like sodium or salt in the diet, and how can they plan their meals and make them flavorful without adding salt.
Sure.
And which brings up our kidney health, which is another big risk factor for people who have diabetes. Our kidneys, Kaylene, are our filter for our body. Our heart is our pump. So if we're talking about analogy of a car, it's a pump, like a fuel pump, or you know, it helps get the blood throughout our body. And our kidney works as a filter. And we want to keep that filter nice and taut. We want to keep that filter keeping in the good stuff and taking out the bad stuff. We don't want the bad stuff to, the good stuff to go out.
Sure.
So part of the risk of diabetes, of uncontrolled diabetes, can be kidney disease, which brings up the point that Paducah is one of the sites in Kentucky that is going to have a kidney early evaluation program November the 14th. And the last we heard, there were still openings. There's only 75 slots. But we really want to get every slot filled.
Sure.
And
this is a great opportunity.
It is.
I mean, normally this would cost, and so this is
a lot, like over $300.
Yeah.
And again, it's available only in a few cities over the Commonwealth. So we are really, really excited to have it in Paducah. And so if anybody's interested, you can call Deanna or I at the Purchase District Health Department, and we can give you the number to call for the appointment. And I believe it's going to be on the slides as well after this.
Yes.
Yes.
Yeah, so people will be able to get their information.
And also we want to have a good showing because we really want them to come back next year. And it's not only just a screening, but they ask you who your physician is, so they'll send your test if you want them to your physician. And when you get your results, it actually explains all the different things that they're testing and really what it means. So it's not only evaluation, it also has a wonderful education component to it. So our kidneys are such an important part of our body, and you know, we have one heart and two kidneys, and kidney health is so important.
Absolutely.
And we have to learn how to take care of those kidneys. Julie addresses in our classes about watching the amount of protein that you eat, watching the salt in your diet to help control your blood pressure, because that blood pressure number is so important. We want people with diabetes to keep their blood pressure 130/80 or less. And also with our kidneys, we teach them about certain lab tests that their doctors are ordering to watch, keep watch on their kidneys. Because the thing about the kidneys is by the time you start having symptoms of kidney disease, your function has gone down to just 20%. So you've already lost most of the function of your kidneys. So this kidney early evaluation program, the KEEP program that's coming to Washington Street Baptist Church here on November 14th, is very important for those who have diabetes, for those who have had family members that have had kidney disease, and for those who have high blood pressure. Those are going to be some of the high risk for kidney disease. So if they have any of those conditions affecting them or their family, then they qualify to come down for those free health screenings. And we, like Julie said, we hope to have all those slots full and have everybody there.
Sure.
And provide this program. And we thank the National Kidney Foundation for partnering with our local coalition, Purchase Area Diabetes Connection, to help put this on. So.
Yeah, absolutely. Yes, it's you know, when we get something like this in our community, you need to take advantage. You know, all the people out there that have you know, any chronic disease that would be, you know, needing this would absolutely should come to it.
And we found out that there are people coming to Paducah for this screening as far away as Fulton. So we're excited that the region has this, not just Paducah, but the whole region has
Absolutely.
it. So
Yeah.
we love it. It's a
Yeah.
it's a wonderful, wonderful
Good. Good
screening.
deal.
Yeah, so it's open for any of our surrounding county population.
Good. And I know we have information about the Carlisle class that you're having too on the screen. Well, thank you so much.
Clinton.
For, was there?
It's actually in Hickman County.
Hickman,
in
okay.
Clinton.
All right.
That's okay. We'll have one in Carlisle soon too.
That's right.
So it's
Okay.
okay. We were just there. But that's
Okay,
good.
all right.
Yeah. And we're there
And
every
it's
month.
our
actually.
Carlisle County has one of the support groups that we have that meets monthly, as well as our
Okay. Maybe
Paducah
that's what I
support
was
group.
thinking, support. Okay.
Yes, yes.
Yeah.
So that's something else that people with diabetes have is support groups out there, and we're looking to form many more because we know there's so many more people out there that need it.
Sure. Yeah.
Yeah.
Well, throughout our discussion today, hopefully you have learned more about diabetes with its management and the importance of keeping it under control, along with who is at risk for diabetes and how we can decrease those risk factors. A chronic disease can be very manageable, and it's possible to live a healthy life. We have the information for the upcoming events on the screen here for you, and please take advantage of them. Thank you for watching our show today, and thank you again for coming and sharing. It's so important, and this outreach is just fabulous to have.
Thank you, Kaylene.